dentistry seems stuck in the Middle Ages compared to advancements with all this laser talk. Is that where we're at? In other fields like organs transplants, kidney, liver, heart, even eyes, which have countless nerves and veins, yet dental care remains rigid, limited to either root canals or implanting metals and plastics in our mouths. The concept of filling teeth with natural biocompatible materials like hydroxyapatite isn't widely embraced. Instead, the focus is still on using plastics and potentially toxic metals. Why hasn't dentistry evolved beyond these outdated methods? That was an evolved word. That was an evolved word, doctor.
Yeah.
Can we expand on what hydroxyapatite is?
Well, the hydroxyapatite is a tooth material. The tooth is made of that material, hydroxyapatite, and that's what this caller is referring to. Great question, by the way. Very critical thinking, right? So what you're essentially asking me is, can we essentially transplant a tooth, right? Or can we, because this, you can do the kidney transplant, heart transplant, liver transplant. Why can't you transplant a tooth? So you can do the transplant within your own body or within somebody else's body. For example, dentistry, we have looked into doing two ways. One is, we are transplanting a tooth from one place. For example, let's say somebody has a wisdom tooth that is not needed, or it is underneath the gum line, and you're going to end up losing a tooth in the front here. Can we remove that and then can we put this in here, right? That is number one. And can we remove the tooth from somebody else's body and then put it in somebody else's body, right? And that's the other possibility, right? We have looked into both of them. Sometime, in medicine, we say the risk versus the benefit, or, we do a lot of cost benefit analysis, whether it is really worth, just going to an extent to get the tooth from somebody else's body and put it in somebody else's body to make it work. The answer is, we have tried all of this and it may not be cost effective to do the procedure. You can do the implant or maybe 1/100th of the cost of getting a tooth from somebody else's body and then try to do and all of that. And again, even getting it from your own body to predictably do the procedure, give it to the extent that you're going to be happy, we are not able to do that. And that's why, and going back to the cost benefit analysis, implants are much more predictable as compared to going with the transplanting your own tooth or transplanting from somebody else. And that's why we haven't gone to that extent of the transplant. Whereas opposed to, that is not possible in the medical world. That's why we are going that route. But we have other options as far as the dental implant, and that's why we have to do it. So in simple terms, when your knee goes back, they don't transplant it from somebody else's body. It's the same way. So whenever your tooth goes back, we transplant it with a metal, which is an easier option as opposed to the other.
Absolutely. Doctor, what do we call those type of people with such a complex question? What do we call them, doctor?
Nerds? What do you call them?
Smarty pants.
Smarty pants. There we go. Okay, you're going the smarty pant route. Okay, you got it.
Mm-hmm.
Yeah.
Perfect.
Critical thinkers, right?
Yes.
There we go.
Absolutely.
Yeah, smarty pants.
Okay, you guys.